Every year, the government of Uganda, with support from development partners, procures millions of dollars worth of family planning commodities, including condoms, pills, injectables, and implants. These supplies are distributed to public health facilities to ensure women and couples can plan their families safely and affordably. However, some of these commodities do not reach their intended beneficiaries. Instead, they are diverted into private pharmacies and clinics, where they are sometimes sold despite being publicly financed and labeled for free distribution. Medroxyprogesterone acetate, commonly known as Depo-Provera, Implanon, and the Copper T IUD are some of the commonly leaked commodities into the private sector. In the last financial year, the government of Uganda spent a paltry 5 billion shillings on family planning commodities to enable those that cannot afford them access them for free. However, we were able to find these two government not-for-sale products in a private pharmacy being sold at 11,000 shillings and 3,500 shillings illegally. But this is a problem government is aware of.
We provide family planning commodities both to public facilities and also private not-for-profit, but also other accredited facilities which are what? Which are under us.
These people found markets for these commodities outside the country and in many other areas, which, of course, using our systems, we detected and we terminated that collaboration with quite a number of them. However, of course, in that effort of making them available in the drug shops, we had created an appetite for these items. The appetite had to be, of course, we had to find ways of satisfying or filling that new avenue that realized. So that is the origin of the pilferage, especially for the family planning.
While there is no official consolidated national figure quantifying exactly how much Uganda loses annually due to such leakages, global and national cost analyses show that failing to meet family planning needs comes at a very high price. According to research by the Guttmacher Institute, meeting all unmet need for contraception among adolescents in Uganda would cost about $19 million annually, approximately 68.4 billion Uganda shillings. But without that investment, the country spends more than $115 million, approximately 413.9 billion Uganda shillings each year, managing unintended adolescent pregnancies and related maternal and newborn health care. That is more than 6 times the cost of prevention.
For young people who are already sexually active, we've seen parents confidently bring them to our site or even to public facilities to access contraception. And it is good to protect them from getting pregnant and dropping out of school, but also allowing them to be children, allowing them to go through adolescence and allowing them to complete their education and continue with their aspirations.
Uganda's unmet need for family planning remains significant, with roughly 1/4 to 1/3 of women who want to avoid pregnancy not using modern contraception. When contraceptives are unavailable in public facilities due to stockouts or diversion, unintended pregnancies increase. Research shows that meeting even half of the unmet need for contraception in Uganda could avert more than 500,000 unintended pregnancies and significantly reduce pregnancy-related deaths. The consequences go beyond health facilities. Unintended pregnancies increase pressure on already stretched maternity wards, raise risk of maternal complications, contribute to unsafe abortions, and strain household incomes. At the same time, when subsidized public commodities are sold in private outlets, they undercut legitimate private distributors, weakening efforts to build a sustainable and complementary private sector for family planning services.
And that impacts the private sector in the sense that the commodities that are already brought by private sector players become slightly expensive because they are black market commodities from the public sector. So in effect, that constitutes what we call market inefficiencies and also market failure. Market inefficiencies in that instead of priming and building the private sector market, we are weakening it by providing blacks market commodities.
Experts say strengthening accountability from procurement and storage to last-mile distribution is critical to ensure that every dollar invested in family planning delivers value.
We've tried to disrupt. We have now more than 70 health workers whom we've arrested. Some have been sentenced being involved in the theft of government drugs. We've recovered more than the drugs worth more than 15 billion Uganda shillings since 2019 in just a period of 7 years. It is estimated that government loses up to 40% to theft. Drug leaving government stores, not going to the patients who actually need them in government hospitals. Where do they go? They go to private players. We have intelligence and evidence of some of our products being smuggled into southern Sudan and Congo. Illegal possession of government stores attracts up to 10 years in prison.
As government, we will explore our systems. We'll look again and see where these leakages are coming from. Are they occurring, after the medicines have left the warehouses, or are they occurring at the health facilities? We've launched what we call total market approach. So the pharmacists and the drug shops can be able to provide commodities at subsidized rates, and people should be able to pay them. But these commodities should be very different from the ones which are being provided from government.
So there is need to scale up and recognize that under the public-private partnership framework for health, the private sector plays a key role only and if supported by policies that are progressive, but also most importantly supporting the existence and providing an enabling environment for private sectors to play.
Beyond the numbers, access to contraception is not just a health issue, it is an economic and development priority for Uganda. Walter Mwesigye, NTV.